Aloha and good evening. Thank you for joining us this evening. We hope you're in the right place. We have got a great session of Ask-A-Kauka coming up this evening, but we're going to hold on just a few more minutes and let some of the people trickle into the room. If you are here already, maybe you can put into the chat where you're calling from and maybe even why Kūpuna Care interests you, or keep it simple. Just say hello, say aloha. We'll be starting it in just a few moments. Thank you. Aloha mai kākou. Thank you for joining us this evening. You're in for a treat this evening, another edition of Ask-A-Kauka featuring Kūpuna Care. My name is Kim Ku'ule Bernie and I'm with Papa Ola Lokahi, and tonight's session is brought to you by Papa Ola Lokahi, Ahahui o Nakauka, the Association of Native Hawaiian Physicians, and several other collaborators and sponsors that Dr. Kamaka will talk about in just a little while. A few housekeeping issues: that this is a webinar, not a meeting, so you all will be muted. But if you have questions, please don't hesitate to put them into the Q&A panel at the bottom there. And we want to know a little bit about you. So if you want to tell us where you're calling from, go ahead and put them in the chat, and we'd be delighted to learn a little bit more about you. This presentation is being recorded and it will be archived on Papa Ola Lokahi's Vimeo page. In addition, it's being live streamed on Facebook, both Ahahui o Nakauka, Papa Ola Lokahi, the NHPI 3R team, and Keola Mamo as well. So thank you for joining us this evening. I think that takes care of all the housekeeping guidelines. I'm going to turn it over to the Secretary of Ahahui o Nakauka and past President, Dr. Martina Kamaka.
Aloha kākou. I'm so happy to be here for this third installment of Ask-A-Kauka, or Ask-A-Kauka series. This started last year in 2020, where we had about 6 of them. So this is the third of 2021. And obviously with what's happening in our community right now, our Ask-A-Kaukas have focused a little more on COVID and the impact on our community. I'm really excited about this evening because this particular installment, we're going to focus particularly on Kūpuna Care. And of course, there's going to be some questions on that. What does Kūpuna Care mean in this time of COVID? But before we go on, I again want to thank, obviously, Ahahui o Nakauka for sponsoring this, but also Papa Ola Lokahi, the NHPI 3R team, the COVID response team, as well as the National Council for Asian and Pacific Islander Physicians, and Walmart for grants supporting this program, as well as the Urban Institute. So I have 3 wonderful physicians that are going to be our panelists for this evening. They are all family physicians who do a special have a special focus with working with Kūpuna in our community and doing Kūpuna Care. So I'm going to quickly introduce them, and then we'll get right into what I know you're all looking forward to, is what wonderful information do they have to share with you? So first, I'd like to introduce Dr. Nicole Māhealani Lum, who is also a board member of the Ask-A-Kauka. She's family medicine and also did her residency fellowship in geriatric medicine. She's currently the medical director at Keola, and this is her way of giving back, I think, for having the Native Hawaiian Health Scholarship Program. She has deep roots in Hawaiian traditional healing. Her great-grandmother was a kahuna la'au lapa'au in Waipio, and her family is very active in the Papa Ola Lokahi there at Pearl Harbor that they're restoring, a wonderful place I've been privileged to visit fairly recently. And she also wants to let us know she's a proud mom of a 2-year-old. Next, I have the father-daughter team, Doctors Takemoto-Gentile. So Dr. Curtis Takemoto-Gentile also is in family medicine. He has particular interest, as I said, in Kūpuna care as well. I first got to know him when he was in charge of the family medicine program at the John A. Burns School of Medicine. And his philosophy is to try to keep Kūpuna working functionally as long as they can, living a long and prosperous life with as naturally as they can. His daughter has joined him recently in his practice, and she actually was residency trained at the Robert Wood Johnson Medical School Family Medicine Program. And then it sounds like you were in New Jersey for a little while before you came home. So that's Dr. Krishanna Gentile Takemoto and her dad, Dr. Curtis Takemoto-Gentile. So thank you to the three of you. I'm hoping at some point that my co-facilitator, Don Kaniaupio, is able to join us from the Kūpuna network. She's the source of a lot of the questions that we will be asking you. And if she can join us, I'll let her ask you in person. But otherwise, oh, she is here on the phone. Aloha, Dawn, thanks for joining us. So Dawn, I'd like to go ahead and start off our session this evening. Would you like to introduce yourself real quickly and start off with our first question that comes from your network?
Sure. Aloha, everybody. I'm sorry I joined a little late. As she explained, I'm Dawn Kaniaupio. I'm a filmmaker here in Honolulu for 30 some odd years. My most recent project as it pertains to Kūpuna is something called the Kūpuna Network. I hope some of you are aware of it. We got it up and running in October of last year to kind of address the needs of our Kūpuna who were not able to safely come out of their home for a period of time. So we wanted to get as much content into their homes, giving them information about what's going on, entertainment. We had musicians, hula dancers, all kinds of different content that we created over the course of about 2 months. And we now have it living on demand on Spectrum and all over the place on different platforms. So to get started with some questions, I had put it out there through our network that we were going to have this Zoom and wanted to know what were some of the things they were interested in hearing about right now. And not surprisingly, it was all about COVID. And I guess the first question was really about the booster and when should they be looking to get the booster? What will that process be for them? Because many of our Kūpuna got their first shot very early in the process because they were that first group to get vaccinated. And so there were so many resources available then of where they could go and transportation to get it and all of that good stuff. But now that we're this far into it, I guess they're kind of wondering how the rollout of the booster will be for them.
Okay, go ahead and unmute yourself, whoever wants to take this first question. Maybe Dr. Lum?
Mahalo for your question. The booster shot, I've been getting a lot of questions about it among my Kūpuna patients in our practice. And as you said, a lot of them got their first dose of the vaccine early on at the beginning of the year, January, February. So it's about that time that was recommended, 6 to 8 months after the second dose, to get the third dose of the either Pfizer or Moderna shot. I have told my patients that I recommend that they get the booster shot to help prolong the immunity that they benefited from with the first 2 doses, as their immunity may wane after the last dose. As of yet, I'm not sure what the timeline and the exact structure of the rollout looks out, though I do know that some sites have already been giving that third booster shot, especially to folks who self-identify as having an immunocompromised state. So I've told my patients who do have some kind of functional compromise due to their age or their medical comorbidities, that they may seek some of those sources to get the booster shot. But I also tell them that it is also early and we don't have all of the information yet to give us a full picture of the timing of the booster shot and the longevity of the immunity, any potential side effects. It's still very early, but I'm very excited to hear that a lot of patients are already planning for it. So that's just my input for now. Mahalo.
Dr. Lum, is this unusual for a vaccine to wane in effectiveness, that you might need a booster shot?
With other vaccines that are out, for example, shingles shot, there are probably different facets. Either the immunity wanes over time, or a new brand of the vaccine comes out and is able to provide additional protection. So in years past, it was the Zostavax shingles or herpes zoster vaccine that our Kūpuna were recommended to get. And now the CDC and the ACIP upgraded or updated those recommendations, and now it's the Shingrix vaccine that is now recommended to add on to that protection. So maybe not totally unusual.
Yeah, so you see this with other vaccines where they might need a booster. So this isn't, they don't need to be concerned that this is something unusual with this particular vaccine. Okay, thank you. To our other 2 panelists, did you want to add anything to that, or we can?
Yeah, I do want to say that, so I got the Pfizer vaccine because we were early in being able to get the vaccination, not just because of age, but because we're in the healthcare field. So I got my first shot in December, followed by the second shot in January with the Pfizer vaccine. That's what was available initially. Good timing in the sense that that's also the vaccine that is currently approved for the booster. We're still waiting on the official word on Moderna, which came out 2 months after Pfizer got approved. So I suspect Moderna will be approved for the booster as well. We've had discussions about whether you can mix vaccines, and there's no official word of approval that you could, if you had Moderna, you could do Pfizer. If you had Pfizer, you could do Moderna. So primarily, I think with most of the Kūpuna here in Hawaii, most of our senior patients have gotten the Pfizer shot. If you were part of the first, if you took an opportunity, if you took advantage of the opportunity to go early. So it's correct that 6 to 8 months, 8 months is a good time to get your booster shot with Pfizer. I got my booster shot last week over at Windward Mall. Initially was done at Castle, is where I got my initial vaccines, and they have set up shop at Windward Mall, and they can either make an appointment or go there. They're open 6 days a week, and you can go there and just stand in line, and they'll fit you in, or you can call ahead of time and get an appointment. Take your card with you because they will validate that you had the first 2 shots, and then they'll add on the third sticker with the third booster on there. The one thing I've told all of my kupunas is that if you want to have less reactions to the shot, it's very important that you hydrate. So for 3 days, the day before the shot, the day of the shot, and the day after the shot, if you drink 1 to 2 liters of water, it actually helps to mitigate and reduce the reactions to the shot. Many of my seniors will call back and said no arm pain, no fever, no headaches, no fatigue. They thought it was the easier shot to do. So I noticed also with my booster, I hydrated way more than I did with the first vaccine, and no arm pain, no fatigue, no fever, nothing. In fact, I even questioned, did I get the shot? I didn't feel anything. So definitely you want to get the booster. It'll build up your antibodies again to keep you safe from COVID, especially the Delta variant, which is much stronger.
I think it's important to note that we do know of our kupunas that have been vaccinated. Extremely rare to get very sick from it if you happen to get some of these breakthrough infections you may be hearing about in our community. And very few of our kupuna are ending up sick in the hospital. So, you know, we do know that the vaccine is working. So keep your ears and eyes open too for I imagine once they officially roll out the booster for the population, that it may be a little easier to access some of these sites, and maybe you won't have to go stand in line and wait. So we'll see what happens. Dawn, did you have another question that you'd like to ask our panelists?
Yeah. I do have, actually, I'll just bring up both of these in case in your answers, you might touch on both of them. One was, is there any concern if they're getting the latest flu shot is there any time in between the flu shot and the booster that is safe, or does it matter? Is it irrelevant if you get the flu shot and the COVID booster around the same time? And then second, even though there isn't a stay-at-home order in place right now, you know, a government stay-at-home order like there was early on in the pandemic, and the numbers are so much worse than it was the first time around, and the Delta variant being what it is it the recommendation that our kupuna go back to that way of being that they were recommended to do when this all first started? So should they be self-doing that, even though the government hasn't put out a stay-at-home order? So just those two.
Those are great. So I think let's tackle the first one first with the timing of the booster and the flu shot, which of course it's that time for our kupunas to all be getting their flu vaccine. We can't forget about that. I'd like to open it up to our panelists to answer that first question.
Yeah, actually, I had that question probably like 4 times today in my office visits. That's a really good question. You know, initially when COVID vaccines came out, there was a time frame where we'd saying like, oh, especially for the kids, like wait so many weeks in between the shots from their regular childhood vaccines, or even the adults who are getting pneumonia shots. That's gone away. So there's not really a time frame anymore from getting the flu shot to getting the COVID shot that's officially needed. You could get them possibly at the same time if the pharmacy will let you do that, or wherever you're going to get it. I will say some of my patients who know they have a more robust immune response when they get vaccinated, so they know they feel a little like under the weather after the COVID shot, or maybe after the flu shot, as their immune system's revving up all their antibodies. Sometimes those patients will wait maybe like a week in between, or maybe even 2 weeks. There's no official rule on that anymore though. So it's whatever people want to do at this point. That's a really good question.
Yeah, that's great information, because I think it's going to be leading into our next question. as we want to keep our kupuna safe and not get them out and expose them too much. If they could get both at the same time, that would be like ideal. Does anybody else want to address this one? Thank you, Dr. Krishanna. Anybody else want to add anything to that before we tackle that next big question that Dawn posed to you all?
Similar counseling that I give to my patients. There aren't any strict guidelines, so you could potentially just go and do it on the same day. Just have those expected your immune system ramping up and those side effects, just one time pill might be easier for folks. Yeah.
Okay, great. Thank you. So we had and I would love to hear from all three of you on that second question. You know, we don't have an official lockdown, but our numbers are even worse than they were when we had a lockdown. So what are you telling your kupuna as far as trying to stay safe? What are you asking them to talk to their families about? And what kind of activities are you encouraging them to do or not to do, and how to do them? So I'd like to hear from all three of you on that one. So maybe we'll start with Dr. Can I just call you Dr. Curtis? Let's start with Dr. Curtis, and then we'll go around. Okay.
Thank you. You know, the message I give is get everybody vaccinated. It's like by and far the most important and best solution to protect the kupuna and their family. So if you really love your kupuna and your family and you want to protect them, you need to be vaccinated. It's clear that it provides the protection that it's supposed to do. And right now, if you look at what's happening in Hawaii, 90%, over 90% of all our hospitalizations are patients who are unvaccinated. So, you know, despite what everybody is reading and misinformation, if you just look at your homegrown data, what's happening at Queens, at Straub, at our local hospitals, we're seeing they're inundated with patients being sick. It's all COVID infections, and they're all unvaccinated. I mean, it's a no-brainer. You don't need scientific research. If you just look at what's happening, it's really the unvaccinated patients that have no immunity to this virus. And the best thing you can do for your kupuna is get everyone in the home vaccinated, and it protects everybody.
Okay. I'd like to ask Dr. Lum, maybe can you expand on that, or maybe talk a little bit more of, so we've got a very strong message about vaccination from Dr. Curtis. Maybe what are some of the other things that they can do to stay safe? I mean, we're not in a lockdown, but you know, they need to be very careful right now. So what else are you telling them to do?
Sure, even though we're not in an official lockdown, a lot of my kupuna patients are self-locking themselves down. They do not want to be out and about with the risk of catching the virus. So I don't have to push a whole lot, but I just reinforce and reassure that that would be my recommendation. Try to reduce unnecessary activity out and about outside of the home, especially if it involves gathering together with large groups with people who are unvaccinated and unmasked. So a big message there is, if you are going to leave the home and be with others who are not within your household, I would still recommend universal masking. And the reason is you may not know what someone else's vaccination status is. And it's just another layer of protection in addition to all of these precautions that we've been trying to do throughout the whole pandemic: washing hands, distancing, masking, vaccination. All of those together can give us the best chance to prevent infection, prevent spread, and prevent all these complications and really horrible things happening to our people. So I think it's hard. A lot of our Kūpuna live in households where there may be unvaccinated individuals. So even within your household, you may be at risk of catching it. And that may be for several reasons, either because you have mo'opuna, small ones who are not eligible to receive the vaccine just yet, or they're going to school and catching things. It might be because some of the older adults or adolescents in the household are eligible for the vaccine but have chosen not to take it. And that's why it's important with the masking. It's sad, but even if within the household you've got unvaccinated members, maybe the best protection aside from that, if you've got folks who are not vaccinating, is the mask. So just really reverting back, I think it's really good reminder to wear the mask. And it's really important to understand that the purpose of the mask really is to prevent yourself from spreading something infectious to others. So when you wear a mask, it's preventing the other person from catching what you have. There may have been some studies done that shows that you can have some protection toward yourself from catching something from someone else if you wear the mask, but really it's about not spreading your disease to someone else like a Kūpuna. So that's the big takeaway as well, that if you're with someone who is vulnerable and you are not vaccinated, please wear a mask. I think in general, just with the Delta variant, everything that's going around, if you're unvaccinated, whether or not you're with a vulnerable person next to you, please wear the mask. And again, it just helps with the extra precautions and that extra protection. The Kūpuna in our family are, at least in my family, very influential people. All of the misinformation about vaccines going around, it's hard for the general public maybe to sort those out and really trust in the medical system to take a vaccine and take that risk and understand the risk benefit of a vaccination. So with our Kūpuna, we always talk about them being vulnerable and we have to protect them, but really Kūpuna are resilient, they're strong. Sometimes they are the role models that we look up to in our families. So Kūpuna out there, really urge your family members to get vaccinated, be that source, that trusting person that your family can rely upon and really trust that they're doing the right thing. If my grandma and grandpa told me to do something, I would do it. So similar concept, I think that's one way that we can help to spread the trust and the vaccine confidence. I did want to talk a little bit about how we can keep Kūpuna safe from non-COVID related things that happen as a cause of the pandemic that's happening. So falls, exacerbations of their medical conditions, all of those, we also have to protect our Kūpuna against. And then just a side note about folks staying at home, there can be a downside to that. Among my patients, I've seen a lot of depression arise, and that may be from the isolation, the lack of social interaction with others. So I do encourage my Kūpuna patients as much as possible to safely meet with family members or peers and friends, even if that means virtually or in a socially distanced type of environment. That way, we also try to stave off and prevent those types of complications happening among our Kūpuna. Mahalo.
Thank you. So I think one of the things that I'm kind of hearing or wondering what you think about is it okay for Kūpuna to assert themselves within their ohana and insist that non-vaccinated family members wear a mask around them? I think I don't know how many of them maybe feel like they don't have that kind of influence, or but I kind of wonder, as we're trying to talk to them today about keeping themselves safe, if part of it is giving them the permission and to empower them to insist on having them be protected, and that means that everybody around them needs to respect that. Any comments on that? I'm kind of thinking that we need to give them that permission to say mask or stay away.
I think that's really, really important. I encourage all my patients. And I especially feel like the Kūpuna are really well revered in pretty much all families, I'm assuming, definitely in our family. And so, yeah, it's a great leadership that can help the whole family to stay safe and healthy. And I've even heard from some of my younger patients that, oh, my grandma told me or my grandpa told me to go get vaccinated, or I can't come over. And so I decided to go get vaccinated. I'm like, okay, great. someone helped me get you vaccinated. That's wonderful. So I mean, I think that is such a huge influence in family members, and it's not always totally apparent, although on my end I see it, because when I see younger patients in the family tell me their elders, parents, Kūpuna got them to get vaccinated, it really shows like what an important role Kūpuna can play in the family. So I think that's a huge thing. So I really promote that. And, even for, right now for this holiday weekend, like having family, if family are getting together, which I wouldn't recommend big family parties, although if families are getting together, make it safe. If you're feeling uncomfortable, like no one's wearing masks and you're inside and you're not sure who's vaccinated or not, just tell everyone wear a mask, and there's no shame in that. I think that's totally acceptable right now. We're in the middle of a pandemic. Or if, outdoor spacing can be done and see a friend or relative outside, and still be able to keep some distance, that would be great too. So I think, speaking up right now is so important for our individual health and the health of our family and our community and our state. I mean, it just goes on and on right now. So yes, I highly encourage that.
So along those lines, I've had both our last two panelists talk about masking. Maybe Dr. Krishanna, can you talk about, not everybody's wearing their mask correctly. What do you tell them about how to make sure that mask is doing what it's supposed to do and it's fitting you? What advice are you giving them?
Yeah, I have this conversation every week with my staff. Having a mask that is, even the cloth masks can make a huge difference. You don't need like the medical grade mask. It could just be like a nice cloth one. I'm like, I have mine right here. The important thing for the mask is having one that fits you really well. Oh, good. My dad's going to demonstrate for us. You want to have one that fits you under your chin, so there's not a lot of gaps there. You want it to fit along your cheeks. Very good. And then even the nose part. So you want to make sure that you've got a good attachment, so there's not like a gaping hole there. And that really makes a difference. So it's covering the nose, covering the mouth, not a lot of pukas around. That's going to be the best kind of mask. And it doesn't have to be a fancy mask. It could just be a cloth, like, a cotton mask that works perfectly. And if someone's mask is falling down, it's okay to tell them, hey, you got to cover your nose.
Yeah. You see that a lot, right? It's slipping down and they're not, and then you've lost your protection when your nose is exposed. So thank you. So I know, one thing, as there may be a little, Kūpuna may be a little more hesitant to go outside or be exposed. What are you advising them about, for example, medical appointments and their regular medical routine care, their blood pressure checks, their blood sugar checks? So that's one question. The other question is, as we moved into this telemedicine world, what kind of challenges have there been for Kūpuna as far as trying to manage technology? Maybe I'll start with, I'll pick on Dr. Lum for this one.
I'll address the telemedicine piece because that's what I remember of that very long question. But it's been a real challenge for everyone to adjust during this time, and medical care has evolved and we move along and evolve with it. It's been a balance between safety and service is the way I see it. How can we still provide these necessary services to our people, but make sure that it's done in the safest way possible? And that's really for anything that we do in medicine, balancing the safety and the service that we provide. I want my patients to continue regular visits with me as their primary care doctor. I want patients to take their medications as prescribed. If they've got questions about it or side effects, then let me know right away instead of just deciding to stop taking it and not telling them about it. I need patients to continue doing their recommended screenings for cancers, checking for high cholesterol and diabetes, to stay on top of those, because those types of diseases will continue to happen whether there's a virus going on, a pandemic going on or not. If someone is feeling sick, please don't walk into the office. Call us first so that we can walk through it. And the way that our practice has kind of evolved is trying to allow these kūpuna, because if it's my recommendation that they stay at home, unless absolutely necessary, then I've got to increase access and be able to provide that service to them and meet them halfway. So we've been doing a lot of telemedicine. Telemedicine for us is kind of mostly telephone visits rather than video visits. And that's just because, as you identified, it's the difficulty with technology. I have only got a handful of my geriatric patients who are able to successfully navigate the patient portal and get on a televisit with me. But majority of the patients, even those who may not be kūpuna, maybe just because of socioeconomic factors, they don't have a smartphone, they don't have internet in their home, they just can't do the video type visits. So most of our telemedicine is just by telephone. And it's difficult. You can miss things when you're not sitting in front of a person, like we were trained during medical school to diagnose and treat. It's even difficult when you're trying to do it, through the video, and it's even more difficult trying to do it over the telephone. So in our practice, we'll try to manage things by telephone as appropriate. And if it needs a little bit higher level of care, then we'll escalate to having the patient come in for these in-office visits.
Thank you. And Dr. Curtis, how are you and Dr. Krishanna navigating this medical world with your kūpuna and technology?
I'll let Krishanna go first, because she's sort of, it's like as soon as this all happened and we were in lockdown, we pivoted right away. And so Krishanna can probably, I'll let her share what we did.
Sure. Yeah, we started pretty quickly doing phone visits and then right away into telehealth, so video, audio visits. We've used every platform, quite a few different platforms. And right now, I would say the majority of our office visits are over telehealth. We've done something a little different really recently called, my new word for this is the hybrid visit, where patients come to the back parking lot, park over there, we bring them out the iPad, we talk over the video visit that way. And then because a lot of times there are some things that we have to do in person, whether it's an immunization or I got to look at a cut or, some sort of physical exam we were unable to do over the video, then either we'll go outside and do a visit outside, or we bring the patient in after the talking part. So we've been getting creative on what's going to work to make the office safe, and then to still be able to be good doctors in diagnosing and treating patients, although it's been a challenge. It's definitely having to think outside the box of how to do things differently. So yeah, I'll pass it back to you.
I will share that I am so impressed with our Kūpuna. And it's whether they're Kanaka Kūpunas or Japanese, Chinese, it doesn't matter if they're 88, 94, 78. I'm so impressed how well they've adapted to the technology. They have a cell phone and they know how to open an email. They can do telehealth with us. And after a couple of times, they got it. I mean, they really, to the point where they actually like telehealth, that they don't have to drive the traffic. They don't have to worry about parking. They don't have to catch the bus. They can get their medicines through telehealth. They think it's the greatest thing because it's convenient for them. And we still interact on the telephone, or in like if they're, sometimes we will lose sound. So I can see you on the video, it's just stay there. I'll call your cell phone. So we'll do audio on the cell phone, video on the computer screen. Or if they're really lost, I tell them, the next visit, bring one of your grandkids over with their iPhone, and we can do FaceTime or connect with the help of their grandchildren. So, you know, it's like being really creative and supportive and acknowledging of their, you know, these old people learning new tricks. They're very capable, and they've been very responsive. And I've been very impressed with the overall outcome about the healthcare that we can deliver. And now the access issue is becoming really small because now we can access anywhere.
Yeah. I love it. I love this creativity conversation and creativeness on the part of the Kūpuna and the part of the physicians. So that may be one of the silver linings of this pandemic, is that medicine maybe is learning, needs to adjust in the future for how we deliver care, and giving us some samples of things to consider. So thank you. I want to ask Dawn if she has another question that she would like to ask our panelists.
They've actually answered quite a few of them. And the technology has been an issue for some of our Kūpuna that we've tried to help. We've created some videos that help them with their phones on how to access certain things, or even just trying to teach them how to FaceTime if they're going to do a telemedicine. But to be honest, there are quite a few, like my mom, for instance, who still uses a flip phone. So she hasn't been able to really participate in any of that. But I think maybe my last question would be, you know, is there something to be hopeful for? Is there an end to this where they can expect to get back to some kind of normalcy? I know that we've had some people talking about that on some of our social media. You know, there hasn't really been signs of hope that this is almost going to be over and that they can get back to some kind of normal. Are you having to deal with that with any of your patients? And if so, you know, what are you saying to them in regards to that? Thank you.
I would like to offer the response to any of the three of you that would like to go first.
I'll go. I feel like I deal with that myself. To be perfectly honest, I think I asked that question to myself a lot. Like, when is this going to get back to normal? I think that's really normal right now to be asking that question. I wish I had a great answer for that. I feel like as our state gets closer to getting more people vaccinated, that we'll be in a better position to start to get back to normal. And the normal might look a little different initially. So I feel like, it's not going to get back to normal all at once. It's probably going to go in stages. I pretty much will celebrate any stage of normalcy, like even if it's just like a little bit. So I think that it is hard to feel like things look a little grim right now and not really hopeful. And I definitely feel that too at times. So, I'm hopeful though, because I know our people have been getting vaccinated. I hear it with some of my patients now who are more open to it than before. So I do feel like things are going to improve. It's just taking longer than I expected.
Dr. Lum, did you want to respond? Did you have anything you wanted to say about that? Yeah.
I know that we can get through this together if our people get vaccinated. There will be an end in sight. And as Dr. Takemoto-Gentile said, it's kind of just taking long. The hope piece of it, I just wanted to kind of talk a little bit more about that. With all of the bad things that are happening in this pandemic, like you said, there have been some silver linings. And I am so hopeful for the ability of our lahui to pivot and to evolve with the times and to respond to these challenges and to come out thriving. I didn't take a second to highlight what the rest of Keola Mamo has been doing in response to COVID. The last question just kind of focused on the clinic, but as an organization, healthcare system of Oahu for Native Hawaiian people, it's amazing to see these communities come together, band together and address the needs of people. Keola Mamo has sites at Waiʻanae, Ho'olauloa, and also by Manalo. These are places where we have the highest population of Native Hawaiians. And in each of those communities, they really just responded quickly, saw what their people needed, and they are very unique needs. And the community just banded together and helped one another to get through it. Where there were loss of jobs, loss of medical care, loss of housing, loss of food security, the community responded in the form of, for example, with our community health workers working together with individuals to apply for Quest or medical insurance, helping individuals and families apply for rental assistance, putting on food distributions and resource distributions across the islands, making sure that families had a Christmas. Some of our staff members host adopt a family type program so that these children can still have some sense of normalcy during such a difficult time. And never before in my short career as a doctor, has there been such a coming together of communities and of people to respond to such a huge healthcare crisis. And it's really admirable what each of our communities and all of these groups and all these clinics and healthcare providers are able to do, instead of feeling like we're just in survival mode, kind of looking to all of those great things that have also been happening in the midst of it all. And in my practice, little by little, I see small rays of hope that we're getting there. With each person that I counsel about getting vaccines, it is such a huge win. If just one of them who was previously against getting vaccinated says, you know, I think I'll just go ahead and do it. I think you're right. So just to see that change and make that impact on someone, it's going to down the line have such a great impact on other communities. So I see the end. I see that we're moving there and we're in it together. It's a kako thing. It's only by that way that we're going to be able to get through this. And I mahalo each and every one of you out there in this world for doing your part, because that's how we're going to get through it. Mahalo.
Yeah. Thank you for sharing that additional information about Keola Mamo and resources, which is actually a question I was hoping we could get to at some point. So I'm going to go right into that and maybe ask Dr. Curtis and Dr. Krishanna, what are your favorite resources for Kūpuna right now, as far as answering questions or the kind of support that they're needing in your practice? What have you been falling back on as far as resources for them?
It's I'll answer it this way. It's I have to take care of me first, because I've found that through the year and a half, getting people to vaccinate and then dealing with people who aren't vaccinating, what comes up at times for me is the anger, the impatience, the loss of compassion, feeling burnt out, feeling at times discouraged. And, it's like I'm in it and I recognize where I'm at with it. Krishanna and I went like nearly 15 months without taking a break, and it took its toll. And finally we decided, you know what, we need to take breaks for mental health, our own spiritual health. And, and reading certain things, like as Dr. Lum was talking, it was like what came to my mind was Nana Viri's book, Change We Must. It's like we're presented with a challenge and we cannot continue doing things the way we are so used to doing things. It's like as a community, as Ohana, we must adapt and we must change. Change we must. If we're gonna get through our challenges, it's not an individual that's gonna get through this, it's all of us. And we saw a glimpse of this when the vaccine came out and all our seniors went out and got vaccinated. We could see the counts dropping. We could see the hospitalization rates dropping. It was like right there in front of us when we acted as one Ohana to do things together. We changed and we started making a difference. And then we got a new variant, and it's like what's showing up are the people that resisted, that refuse to change. And it's really heartbreaking. Families losing family members. It's heartbreaking to watch when it doesn't have to happen. And I feel so bad for our hospital staff that they're working so hard. And it's, as doctors, we're not trained to watch people die in front of us. Our whole mission as Kaukas, as doctor, is to make their lives better, to keep them alive. And it takes its toll. I know what it's like. And it's like, I wish we could get, as Tutu would say, these Kolohi people, so knucklehead, if they could just change, things would get better. And it's like, that's my message. It's like, change we must.
Mahalo for that really powerful message. Hard to follow that. But I know for myself, just thinking about the future and getting back to normal, I really think our normal is going to be a different normal. We're going to think twice about things that we used to not think about. I do think that come flu season, I'll probably be wearing a mask, even if COVID isn't an issue, because we hardly had any flu when we were all wearing masks. So there are some benefits and some good changes that we can make as a result. So that was just my thought about it. I love what you shared with us, Dr. Curtis, about that we can't keep doing the things that we've always been doing. That we need to adapt. And that is the history of our people, right? We've been given challenges and we adapt, and that's how we survive. I think that's really, really, really an important part. I think the other really important message that I heard from you all was that our Kūpuna are resilient and they can be leaders within their hanas in this movement, and that doing the best we can to keep them safe in our practices, but that also keeping themselves safe within their home and speaking out about that kind of thing is also really important. The other thing is self-care, not only self-care for Kūpuna, which we didn't get to explore in as much. I think we talked about it just very briefly with Dr. Lum, and that's a whole nother Ask-A-Kauka I think we can do on Kūpuna self-care. But I think the message of caring for each other, for our kauka taking care of themselves, this is a very, very difficult time. I think never, at least in my practice, have I had so much pushback from people on medical things that I give advice for and questioning. So I think that's a really difficult situation for us as medical people that we haven't had that kind of pushback before, and that's difficult and painful. I think, yes, there is conflict within our community, within our families. That is also very difficult. So I was really impressed recently. I think Pope Francis came out with a PSA encouraging people to vaccinate. And he said vaccination was, I don't know the exact quote, but it really was a demonstration of love. And it was love for humanity, love for your neighbor. To get yourself vaccinated, you're actually taking care of those around you, those you love, those that are in your community, in your lahui. So I really appreciated hearing that, and you all have just reinforced that message so much today. Don, I've been talking. I didn't give you a chance to say any last words. Are you still with us? Oh, no, I think she may have left. I'm sorry. I do want to thank the Kūpuna Network for getting us started on this conversation. Hopefully, we've been able to answer most of the questions that the Kūpuna have. I'd love to give each of my panelists like 30 seconds with some parting words for the Kūpuna in our community that may be listening, or their families that may be listening. Word of advice, word of encouragement, 30 seconds. Love to give you each a chance. So we'll start, I think, with Dr. Curtis.
Okay. It's just care for one another. And if Tutu talks, listen. They come with wisdom far beyond what school could give. So if Tutu says get vaccinated, do not wait, do not question, just go and get vaccinated and be safe. Just be safe out there.
Okay, Dr. Krishanna, your turn.
I would say, be kind to each other, care for one of each other. And it's okay to feel a little down and frustrated. And that's really normal right now. Just know that things are going to get better in the future. It's just will take some time.
Okay. Thank you. Dr. Lum?
In honor of our mo'i, her birthday yesterday, just wanted to share one of her quotes. This was published in Ka'aupuri Honua, February 16, 1881, Queen Lili'uokalani, in response to the smallpox pandemic. Know that my heart is filled with sadness and that I am hopeful that this disease will not spread amongst us. I am doing and will continue to do everything within my power to prevent its spread, and I am strongly asking everyone to assist me in doing everything to defend against this disease by obeying the directives of those in power, along with the medical doctors. and I am strongly urging that people go in large numbers to vaccination sites and to stop gathering in places where there are large amounts of people. Our Kūpuna had wisdom. It's in our history and it's happening throughout time on the spectrum. But in that wisdom, we can learn and we can get through this together as a lahui.
Mahalo nui. Mahalo nui. Mahalo nui to Dr. Curtis Takemoto-Gentile, Dr. Krishanna Takemoto-Gentile, and Dr. Nicole Māhealani Lum. Thank you for joining this third installment of our Ask-A-Kauka series for 2021. I would like to again thank our sponsors, and I'm going to turn it over to Kim Burney from Papa Ola Lokahi, who has some important announcements.
Thank you so much, Martina, and to all the fabulous panelists. I was moved by all of your mana'o, and we've been getting some great comments on the Facebook page. I'm going to share screen here because we do have several other events coming up. And in order to encourage the change, we must. We've got a lot of different things we hope will activate change. Right now, I think most of the island knows that the number one, the highest infection rate is in 96792. So there are a lot of different testing and vaccination events going on. Here is a big one tomorrow at Nanakuli Village Center. I'll be there, and we expect to actually, HPH is providing the vaccinations and Project Vision is doing the testing. It's also Hawaiian History Month. You may know that we had Nanaike Kumu, a healer in every home. That took place at the exact same time of this presentation. So I hope that you guys will switch and listen to the other ones. But ʻaging and Papa Ola Lokahi has been able to organize 2 panels for the 3rd week called Ho'ola. On September 15th, we're going to feature historian Dr. Isaiah Walker, who will talk about the history of epidemics in Hawaii, followed by Dr. Jerry Walker, no relation, who will talk about the history of Hawaii's hospitals. On September 17th, we'll have 2 archive graduate students who will be presenting information about epidemics from the Hawaiian language newspapers, followed by a special reading by Deanna Espinas from a special reading of Olivia in Exile in Kalaupapa. And that one should be really quite beautiful.
Kim, just real quick, that session is actually going to be at 7 p.m.
Oh yeah, that's right. I didn't change the times yet. You got it. Thanks for that. We'll have it posted. Next week, September 10th, we've got 2 Hawaiian OBGYNs. They will be talking about answering all the questions that have come up over the last many months about how safe are the vaccines for pregnant women, for breastfeeding women, and so forth. So you want to talk about women's health, join us next Friday at 7 o'clock. We just finalized this, and this will actually be the 17th starting at 4 o'clock. Stories from the field, Dr. Gerard Akaka, who's with Queens, and Dr. Kaohimanu Dang Akiona, who's with Premier Medical Group in Hilo. They'll be sharing their stories from the field. We've got some programming from Molokai related to recovery. September is Recovery Month, and this is really just a sample of a lot of programming we have this month on addiction and recovery. We've got hurricane preparedness. Our last one is tomorrow, 3 o'clock, with Kawila Kili'i Kanakaole. Dr. Sherry Daniels will be featured on a national forum, the Asian and Pacific American something council, but it's a national forum, and we're very pleased that she'll have that opportunity. Mahalo nui to Martina and Dr. Martina Kamaka and Don Kani'opio for facilitating this session on behalf of Papa Ola Lokahi, ʻaging, and CAPIP, all of our sponsors and other presenters. Mahalo nui for joining us this Friday evening. Malama ke kahi.